The recent revision of the classification of myeloid neoplasm included, the WHO did it in 2016 and published recently, included a number of diseases that had inherited predisposition. And this is true for, and of course this disease have been characterized and divided per the mutated gene. So we have patients that have, for instance, ankyrin mutations. These are patients that have a familial form of thrombocytopenia that quite frequently has been mistaken in the past for MDS, and still patients may refer to you with a diagnosis or misdiagnosed with MDS. These are patients that may develop AML and may progress to high-risk MDS truly, even if they are not presenting with the disease itself. Then these patients are not children. These are maybe all adult children. And as there are other forms like GATA2 mutation that are more peculiar of children and young adults, there are other forms that are still inherited, like mutation of DDX4, that are, they are in fact sometimes shown in adults. And this patient may be diagnosed only when they are in their 40 or 50 and they are already progressing to AML. One important thing to say is that these patients sometimes must be transplanted. And it is very important, therefore, that we choose a donor that is not a familial donor, because other members of the family may carry the same mutation, even if not clinically evident. And again, another important point to these is that these patients have to receive a genetic counseling that is not usual in hematological community, but is very important because other members of the family may have the same disease.